Tonight on Reality Check, the escalating controversy over the Aarogya Setu app, the government's anti-COVID app that uses GPS and Bluetooth to try and combat the coronavirus. Similar to apps around the world, and just as in India, across the world there's a fierce debate raging over these apps because on one hand they guarantee or they promise to guarantee a degree of protection against the virus, but on the other hand there are serious questions of the violation of privacy, whether these are in fact turning into surveillance tools. Now in India the government has attempted to answer these questions, but are those answers satisfactory? All the more given that here in India the app has moved from being optional, from being voluntary into a mandatory platform, as increasingly the government is insisting that groups of individuals and employees, government and private, have to download the app. In some cases, even face penal consequences if they don't. But before we get into all that, let's just first take you through what exactly the app is about and what it requires you to do. Let's just quickly run you through that first. And let's just put that graphic up on the screen as to what are the basic factors of the Aarogya Setu app and how it works. So at the very basic level, it's asking just for your name, your phone number, profession, gender, age, and list of countries visited in the past 30 days. But it also is expecting a self-assessment from you of your symptoms and ailments, a self-health check, whether you have cough, fever, lung or heart disease, etc., and also a self-declaration of whether you've tested positive for COVID. Now, with this information in hand, the app advises you to keep your Bluetooth and GPS location on at all times, using Bluetooth and GPS to track the virus spread and trace cases, using above the information continuously collecting user location data. When two devices come in contact who've downloaded this app, there's a digital handshake between them, and the user is alerted if they're in proximity with someone who tests COVID positive. This information is shared with the government, giving access to all users who come in contact with the COVID positive person. Now the question is whether this app is indeed safe, and the government has repeatedly changed its privacy policy in response to a number of questions raised about those safety concerns. But are those measures also enough? Let's quickly run you through those. Point number one, the government says that the data served on its server is only for high-risk users. If no symptoms, the data will not be saved. But experts are asking, how is this high risk to be determined? Algorithms are determining the risk factor. Clarification 2 from the government. It says all data collected will be deleted between 30 to 60 days. 30 days if you are negative, if you're in the green zone, and 60 days if you're in the positive, orange or red zone. The response some are asking is that whether the privacy policy indicates that the information can be kept in perpetuity, that the policy says the information provided will be retained as long as the account is in existence and as long as required under any law for the time being in force. Somewhat vague wording. The government also says the data will be anonymized using a digital ID number or a DID. But experts say we need transparency on how data is anonymized, and digital ID alone may not be enough for the anonymization of data. India, experts say, has not published a source code for the app like many other countries like Singapore have done, which are serving as a means to reassurance. And finally, the government says that the data is only going to be used by the government to evaluate the disease spread. No third party is going to actually be using the data. But it doesn't specify who in the government will be using it. That definition, some say, is simply too vague. So overall, these are the concerns broadly over the Aarogya Setu app, and we can put that graphic up on the screen, that a lot of this is stemming from the fact that there are no privacy laws in India to oversee violations. There is no source code, as we mentioned, for independent assessment. The terms of service, the government has said it is not liable. The terms of service in fact say that agree that the GOI will not be liable for any claims in relation to the use of the app, including but not limited to the failure of the app to accurately ID persons in your proximity who may have tested COVID positive. And finally, the question I raised in my introduction, that the optional part of the app has become mandatory, with the Home Ministry saying that all private and public sector employees have to download it, everyone in a containment zone has to download it, and the Gautam Budh Nagar, under which Noida falls, has even gone to the extent of criminalizing the lack of downloading this app, saying that people who don't do that will be charged with a penalty. They face fines, they face arrest. So these are the questions that still surround the app, and this is what we're going to debate tonight. Joining us on the show with us, we have Arnab Kumar, who is part of Team Aarogya Setu, member of the Niti Aayog. Apar Gupta is with us, lawyer and executive director of Internet Freedom Foundation, is joining us on the show as well. Let me just start with you, Apar Gupta, that as we pointed out, the government has made many attempts to try and address the concerns raised by you and others. Have they been satisfactorily able to do that?
I think there's been a response by the government. I do appreciate the changes that policy, which is the primary document which has been changed to reflect these concerns, do not address the larger concern which is there with respect to the verification as well as ensuring the legal basis of this application by itself. Now, the privacy policy is a one-sided contract which is put up on the Apple Play Store or the Apple iOS Store or the Google Play Store, and it can be updated anytime. The government can change it at any measure. And even the updated policy does have problems. I can specifically get into them. But the larger point is this, that all foreign countries are contemplating underlying legislative frameworks by which all this information which is being gathered, number one, is used only for the purpose for which it is gathered, which is to enable combating the spread of COVID. This is not there in India. There's no proposal to do that as well. So when you do not have an underlying legal framework for the development of the Aarogya Setu app, what happens as a second step is that there is no legal limit which is put with respect to the purpose and the limitations for which this personal data will be gathered. And all we have is an assurance which is given in the privacy policy. The second big issue is the lack of transparency. Who are the people building the app? Can we please have their names? What are their defined legal relationship with the government of India? And third and most importantly, what is the product architecture? What is the source code? What is the vision of this app? Will it turn into a e-pass system, just like in China, that without this app you cannot...
You're making a lot of points. You're making a lot of points. Let's try and take them one by one in just a second, but I'll come back to you. Apar, I'll come back to you. Let me just go across to Sean McDonald, who's joining us from Washington, D.C. Sean also works at the intersection of governance and internet policy. Sean, from the perspective of around the world, because as I mentioned in my introduction, a lot of countries have experimented with the app. We keep hearing of success stories. We hear of the South Korea success story. We hear of the Singapore success story. But even in those countries, are there serious questions about whether you're trading off the successes, the supposed success of these apps, with questions of privacy?
Yeah, absolutely. There are always questions of privacy, but I think that the really salient issue in a lot of the success stories and the response have been about healthcare system capacity and a much broader response than just focused in the app. In fact, the head of the Singapore unit has come out and been very explicit about the importance of institutional capacity and the connection to care. The head of the South Korean response, I think, said that perhaps one case has been uniquely identified by their app deployment. And of course, there are many problems in just getting the app rolled out to a basic level of quality, even before we get to questions of privacy.
Okay. So as you said that there are these questions about privacy which are cropping up, in fact, around the world. But Apar, the point that is also being made is that at the end of the day, the government says on one hand that they are not going to make this into a kind of app which is going to be used in perpetuity, that there is a kind of finite aspect to it. You can delete it whenever you want, or when the disease is in control, the app will cease to operate. But when you make it mandatory, when you make it almost an electronic pass to get into your workplace, to cross state borders and so on, then that raises the question about whether there is an exit clause for this app and whether you really do have consent over when you want to use it and when you don't.
So I'll come to the point on consent, but the public statements which are being made in a conflicting manner as well, because Mr. Jadvekar, the learned Minister for Information and Broadcasting, stated in response to a recent query on Aarogya Setu that it is going to be operational for a period 1 to 2 years. And that's natural, given that it's a principal technical response device to deal with this pandemic, which many experts say may last that term. So it's going to stay for quite a long time. It's not going to be 30 days. And also, if you ask for deletion of your data after 30 days, is that data deleted or destroyed? Are copies made, shared with other government departments? And who ensures all of this? A data protection authority, but India does not have one. So what we are being asked to go with today are not clear legal limits which can be placed on the government and enforced, but we are going with a sense of assurance and trust, which is now undermining consent. How? The latest order, which has been issued by the Ministry of Home Affairs under the Disasters Management Act, now requires the mandatory installation of Aarogya Setu, quote-unquote 100% coverage in two places. One, the containment zones, which are a sub-classification of the red zone. And secondly, as per the annexure. And secondly, in all workplaces where there is employees. So this will be pan-national, irrespective of it being in a red zone. But here is the problem.
Okay.
Is the direction.
Can I come to that in a second? Apart. Allow me, because Arnab Kumar, you've again raised many points. Arnab Kumar is finally able to join us, Team Aarogya Setu, member of the Niti Aayog. Arnab, I'm sorry we couldn't connect you earlier, but essentially, Arnab, many questions over whether all the attempts that have been made by the government to reassure those who are using the app that indeed your security and privacy concerns are taken care of. But as we've been pointing out, there are several questions, including why India is not more transparent with its source code, like other countries like Singapore has done. Publish the source code, make that public, reassure people that there's nothing to worry about.
Sure. So let me take a stab at a few of those. The first is the privacy and the security. The first and the foremost thing that we have done from day one is that we have committed to this app being a privacy first by design. The defining principle that is that it's a temporary solution to a temporary problem, which means that we have clearly and explicitly said how we are using the data and when will we delete the information. Most of the information that is on the contact tracing stays on your phone only unless you turn COVID-19 positive. We never push that to the server. The data is encrypted on your device using the native operating system key, which is the most secure way to do it. And if you do not turn COVID-19 positive, we delete this data from your device on 30 days rolling. If we push this data to the server, we delete this in 45 days if you are not at risk. If you have been diagnosed COVID-19 positive, we delete it 60 days after you have been cured of COVID-19. So definite intention to delete the information when it's not needed. We have also given clear...
But I just want to quickly jump in there for a second, Arnab. Arnab, I just want to jump in there for a second, because when you say that it can be deleted, as I just read out in my introduction, the privacy policy says that the information provided will be retained as long as the account in its existence and as long as is required under any law for the time being in force. That sounds rather vague, does it not?
No, it does not. And I think if you read the privacy clause point by point, the particular point that it refers to is the information at the time of registration. That is your name, age, sex, profession, and in profession we only ask for essential services profession. Everything else is in others. The country that you have visited in 30 days.
Okay.
The main chunk of information is the Bluetooth contact tracing, and it is explicitly mentioned in the privacy policy that it stays on the device and it gets deleted otherwise if it's not used. If it's used from the server, it gets deleted in 45, 60 days. So there's a clear definition there. The second clear aspect of it is that what is this?
If you have, but Arnab, if I may, but at the same time, given that now the government is increasingly making this mandatory and is saying that now you need to download it to be able to enter offices, you need it as an e-pass to cross state borders, this is really not then a matter of consent, is it? This is now an open-ended platform.
So I'm not the right person.
You don't have a choice when you can exit from it.
So I'm not the right person to answer these kinds of questions. I'm happy to answer the questions on the product, the privacy, etc. These are some things that other people much more learned than me have decided. See, my simple point of view is that whomever I meet, I request them to download and install this app because it's in our mutual safety. If I meet somebody who turns COVID-19 positive tomorrow or day after, I should be alert that I may have come in contact with somebody, and I should take precaution to keep myself, my family, and my community safe. Contact tracing through automated means works only when a significant amount of population has the app active on their devices. Otherwise, it defeats the purpose. What you have to also understand is that in the rate of infection for COVID-19 is very high. You may have met someone and you may not know about them. If we depend on a manual contact tracing, tomorrow you may not be able to recollect whom all did you meet. Even if you recollect, you may not have their contact information. You may not be able to know their names, etc. If you bump into somebody randomly in a market, how do we alert those people? Or in the case they turn positive, how do we alert you? That is the central thesis of the product with which we are working, and we have taken utmost care to make sure that the product is secure, the data privacy is of utmost importance to us, and we have been moving in the right direction from day one through our privacy policy, through going through extensive testing for the security of the product, making sure that we have stayed open and transparent in everything that we have done.
Right, okay.
Then who are the people who are making the app?
Okay, Apar, would you like to respond to that?
No, I think it's better Sean does with a global perspective because the feasibility of the app, how does contact tracing happen? I think Sean is a better expert. If you can just bring him in for a short comment if he's still there.
Yeah, absolutely. Thank you for the nod, Apar. I think that it's really important to focus on that transmission science that we're discussing, which is this idea that we're asking for people's fundamental rights, where you can go to work, where you can access, to be mitigated by this risk scoring. And what we've seen is that risk scoring has not proven to be meaningful or accurate in almost any real context. As we've already heard, the number of asymptomatic carriers is very high. There's an assumption that we might encounter only one person who's been infected. We may, in fact, and in many cases, people who live near hotspots or who work in hotspots may encounter many infected people. And so I think that one of the things that's really important is that we make sure that the rights that get affected are attached to how confident we are in that risk scoring. And right now, the risk scoring is too early to be at that level of scale. We simply don't have that confidence at the international stage.
Right.
And
the other question, of course, is... Yeah, just a second. The other question, of course, is that, and let's put that graphic up on the screen, about whether the big numbers that the Aarogya Setu is racking up, is that going to be enough? Because currently, we claim almost 9 crore people, that is, Sean, the equivalent of 90 million people have signed up for the app. But if you look at it as a percentage of population, so the adult population of India is 71 crores, smartphone users are 50 crores. The total downloads of Aarogya Setu, though very high, is only at the moment 13% of the of the adult population. So that is a question, Apar, that on one hand, we are obviously concerned about the coercive manner in which you are getting people to sign on to the app. But on the other hand, if a significant enough number of people are not signing up, then can it really be effective?
So, Srinivas, just to answer that very directly, the intervention on public policy needs to be on the basis of measurement and evidence. And what we need is, even if we are installing this application under a assurance by the government that this is a technological intervention to advance a public health priority, it should be within the public health priority and the policy design there. And is this app, which has a certain impact on our privacy, because it is taking up information. Now, it may be open to dispute what type of information and how much information it's taking from our smartphones, but it is certain it's taking a certain form of information. Now, can we at the very least consider a quarterly review of evidence of the feasibility of this app? And can we have these reviews and audit processes instituted through a legal framework? And this is why there is such
that's a good suggestion. Yeah. Okay, that's a good suggestion to have a review. Last word from you, Sean, about the numbers, about what kind of optimum number do you really need to reach for it to be effective?
The short answer is that we still don't know. The early estimates have put the numbers as high as 60% of a total population, which, based on your math around smartphone ownership, is even higher. We have seen most contact tracing, even in sort of very high quality responses, top out somewhere under 20% of total adoption. So we have yet to see any single app get to the level that would theoretically enable it to be effective. So that's where you see some conversation about interoperability, but even that is really optimistic in terms of where we are generally. So while these numbers may feel very big and very significant, in order to solve the problems that they're designed for, they actually need to be much, much larger.
Okay. All right. Thanks very much indeed, all of you, for joining us on the show. That's it for the time we have tonight, but we will continue to track the unfolding controversy and the unfolding questions over the Aarogya Setu app. That's it on Reality Check. Thanks for watching. Good night.